3.
Good afternoon, everybody. I'm Kelly Mullin. I'm a nurse here at Baptist. I know all of you guys from being on the floor. Thank you for listening to our presentation on hand hygiene. Hand hygiene. Hand hygiene is defined as any method that destroys microorganisms on our hands. It's well documented as the most effective measure for preventing the spread of pathogens. The most common mode of transportation is pathogens on the hands. There's substantial evidence that hand hygiene reduces the incident of healthcare acquired infections in the healthcare setting. Even if you don't touch the patient, bacteria can survive on your hands for many days, and on the equipment that we touch, and on other surfaces such as the desks and television remotes and things like that. This includes bed rails and IV pumps and also our computer keyboards. And after we finish this, we're going to do a little black light demonstration to see how well we are washing our hands. On the average, healthcare workers only clean their hands about half as many times as they should. 1 in 25 hospital patients has at least one healthcare associated infection. Healthcare providers may need to clean their hands as many as 100 times per 12-hour shift in order to keep patients safe. Different settings for hand hygiene. It includes our hospitals, nursing homes, dialysis centers, acute care facilities, outpatient clinics, and of course our first responders. Evidence-based practice regarding hand hygiene. There's been lots of studies on this. It is one of the biggest topics that we discuss in our hospital and try to comply with. The goal of hand washing and hand hygiene, the Joint Commission, the Centers for Disease Control and Prevention, and the World Health Organization and the Institute for Healthcare Improvement are all producing studies that give us guidelines with which we need to follow in the hospital and in other healthcare settings in order to keep our patients safe. The goal is to remove as many microorganisms from our hands as possible to avoid transmission. The CDC and the World Health Organization both maintain these extensive guidelines to give us the proper practices in order to maintain hand hygiene. When compliance is high with hand hygiene, the risk for healthcare worker colonization is reduced, and it also reduces the mortality and the morbidity and the cost of treating the healthcare acquired infections as well. Hand hygiene indications. This is when we want to practice before any patient contact, before we do urinary catheters, peripheral vascular catheters, or any devices that are invasive that don't require surgery. And after. Contact with a patient's skin, contact with bodily fluids, excretions, non-intact skin and wounds, and also as soon as we remove our gloves. When hands become contaminated with blood, bodily fluids, excretions, or secretions when touching mucous membranes or non-intact skin, we must be gloved, not only for your protection but the patient's, and also when we touch contaminated surfaces and objects. Technique for effective hand hygiene. When we use alcohol-based hand sanitizers, we want to put the product on our hands and rub our hands together. You're going to cover all the surfaces until hands feel dry, focusing on your fingertips and your fingernails. One of the biggest indicators in the hand hygiene machine will show most of us recognize around the cuticles, and in between the crevices of our hands is where we fail. It should take about 15 to 20 seconds to practice effective hand hygiene with the foaming in. Hand washing. We're going to wet our hands with water, apply the soap, rub them together for 15 seconds, cover all surfaces, focusing on those fingertips and fingernails. Rinse under running water and dry with a disposable towel, and we'll use that towel to turn off the faucet as well. Evidence of the effectiveness. According to the study conducted by the World Health Organization, these alcohol-based hand rubs showed a significant reduction in MRSA rates, which I can't even tell you, after y'all been on the floor, you've probably already been in so many contact rooms here at the hospital. You know how prevalent this is. Also, it showed that in 2010, the increase in compliance with hand hygiene, when it went from 65% to 82%, it resulted in a 51% decrease in hospital-acquired cases during the 12-month period, which is huge. And we all know it's a pain to gown up and wear those gowns inside the patient rooms to protect ourselves. Why don't we comply? What are some of the reasons that we fail? Number one, a lot of people say that cause irritation. It's never bothered me personally, but I have worked with other nurses that their hands will peel. They become so dry. We're too busy. There's not enough time. You're rushing from room to room to room. You forget when you walk out. Lack of knowledge regarding the incidents for healthcare associated infections, how rampant they can be. The sinks are inconveniently located or there's a shortage of them. Lack of supplies. Several times you can walk outside of a room and realize the phone can is empty, and then you get a phone call, and next thing you know, you're on to your next task and you didn't wash your hands. Or the belief that wearing gloves alone will eliminate the need for hand hygiene. How to overcome that compliance. We also have a team here, a hand hygiene team that meets every single month, and they do campaigns. I don't know if any of you guys have seen the stickers around the hospital, have a big fat hand on them. Those are all, when you guys get into the hospital, y'all can get on those teams, and they're really fun. You get points for being there, and you're educating your unit. We can provide our healthcare workers with lotions or creams, and I know there's a lot of talk about doing that, especially going into the wintertime when a lot of our hands tend to crack. We're gonna educate the staff on the proper technique. I know that, I think we just touched on it in nursing school in the beginning, but our CNAs all report to me that it was one of the biggest things that they focused on when they were in school. We'll place the alcohol-based hand rubs in convenient locations that they're easily accessible. We started putting holders on our mobile computers where we can put a foaming can there. We're gonna make hand hygiene a priority in our healthcare facility with awareness. I've seen buttons, I've seen pins, we've seen stickers, posters. We can monitor the healthcare workers, which we have shoppers here that are in plain clothes that we have no idea that they're here, and all of a sudden you get a recognition. You may have seen it around the unit where your photograph pops up and you were spotted practicing good, effective hand hygiene. So it's big, big, big in the hospital. You'll encourage the patients and their families to insist on care that is provided by workers that practice good hand hygiene. Our dietary trays now come with a little fingertips, like a wet wipe, I call it. Encourage your patient, open that, hand it to them first as you're putting your tray down. Encourage them, because you would imagine how many of them ambulate to the bathroom, come back, sit down, and begin their task. Don't even think about washing their hands. How to motivate. These are some of the things that we use in our unit. I've seen the stickers, I've seen the posters. We've started talking about implementing some other projects here that should be rolling out at the first of the year. We want to, especially when the Joint Commission is coming around, improve our healthcare adherence to CDC hand hygiene recommendations. We need to address the myths and misconceptions about hand hygiene. We can empower our patients to play a role in their care as well as their family members, to encourage them to foam in and foam out, wear protective clothing when they go inside contact rooms. And we can produce a video that teaches key points to patients and visitors. I know that that was discussed at the last hand hygiene meeting, that when patients come in and we introduce them to their room and their call bell and the menu system, that we would prompt a video on their television screen to teach them about when they come into the hospital, how important it is for them to keep their hands clean as well as their family members and all visitors. And that's it. And guys, what I would like for you to do is just one little volunteer. Come try this real quick with me. I'm picking on you. We're gonna put a little bit of this in your hand. All right, rub that all over your hands just like you would lotion. Fingers, fingertips, everything, and then we're gonna let it dry. Let's wave them a little bit so they'll dry pretty quickly. And then this is our glitter bug, our black light. We have to go wash them. Hang on, blow them out. Now we'll run around here and wash them real quick. Or you can go right there to the sink. There's one right by the hub.
Yeah, no, she's actually washing with soap and water.
I would like to find out what the phone.
I want to see what the phone does. Can I try it?
You see what the phone does? The phone is not even there.
So the goal is, I didn't put the lotion on while she washes her hands. Anybody who wants to just stick their hand in here without doing that, since we want to sit and wash their hands. It's actually kind of,
Rachel's like, I'm dying to play.
it's actually a little frightening. But Yeah.
And
Good
filthy?
thing. No.
No, not
No,
filthy.
it's here.
Where I was touching the cupcake. She's like all the way around your clean hands that are the worst.
I know mine are.
She's probably doing extra scrubbing.
Yeah.
Yeah.
I was like, oh, you're not catching me. When we did it in class, that's what I did too. I was like, I don't know where they go. Let me do this. Mine was my Fitbit. My Fitbit was lit up. I was like, oh no. You know, I was thinking that when I was
Do
watching.
y'all have any
it.
questions while we wait for her to wash her hands? I also have a handout from the CDC on clean hands, if we could pass that down. And then a little quiz just to see what you may have retained from the presentation.
No. I think I have a pen. Oh, there is.
Yes, ma'am. Okay, now for the big
Moment of
reveal.
truth.
The moment of truth. Just go ahead and place both your hands and wipe your like a nail salon. Can you see? She did an excellent job. You scrubbed in for surgery.
Yeah.
Thank you very much. Anybody have any questions?
She did a good job.
Thank you very much.
Thank you.